one of the stories I've told is one of Peter. Okay, Peter is a 9-year-old boy who is epileptic. He has seizures, but his parents thought that those seizures were a punishment from the forefathers. So every time he has a seizure, he's just left. So say, the parents are saying, okay, after a while, the devils will leave and he'll be okay, which is the case. Most people recover from the seizure, all by themselves, right? But this boy, just after he turned 10 years old, he had a seizure and he died.
Oh, wow.
Imagine if the parent had the knowledge that epilepsy, yes, it's a seizure, but you can actually manage it. You can go to the doctor. Yeah, you can be told how to look after your child or your whoever it is while they're having a seizure.
Yeah.
So it's things like that. I think Milo is more focused on the knowledge of prevention.
Mm-hmm.
Or if you have a condition, Milo wants you to understand what that condition is and how you can treat it. So in terms of the challenge of healthcare in Africa, I think there's a lot of challenges, absolutely a lot of challenges. And Milo is not, I wish Milo could solve all those problems because, but it's like many little problems that coalesce to become,
a big problem,
a huge one. But we just want to solve this one of knowledge based on what we know how to do and how to do well.
Yeah.
That's the one of, sharing of knowledge and information, evidence-based knowledge.
Yeah. Yeah, it's interesting that you shared that story of Peter and how that knowledge deficit ultimately led to the death of him, which is very sad to hear. As you were speaking about that story, it reminded me about some Africans I met with sickle cell disease. I know there's Africans out there who have sickle cell disease, and the cure in U.S. versus the cure in Africa is far and in between different. And the knowledge deficit seems to be even greater in Africa to what I know. I remember having an anecdote, a story where someone told me that, and it's very sad, they told me that whenever someone is going through a crisis with sickle cell, they assumed that the devil was in them, that there was a devil attack, and they would get someone to try to do an exorcism on the person with sickle cell. And as someone with sickle cell myself and who's been through that, that's incredibly scary to think that that's going to solve your issue. You know what I'm saying? And then to further the damage of that, now that person is outcasted. They're like,
yes,
don't hang out with him. He's a devil, or he has something in him. So physically, he's already screwed. And then socially, no one wants to be associated with that African kid simply because of the nature of his sickle cell. So it's interesting to hear your story with Peter, and hopefully, I'm sure the Milo Initiative can help improve the knowledge deficit and issues like that, because it seems like Africans, there's a lot of education that can be valuable for us in the healthcare field.